Welcome to the Spine and Rehab Specialist podcast series, episode number 4. I hope everyone so far is enjoying our podcast series. Hopefully you're learning something out of this, and because that's the whole goal of our podcast series. I think we've been talking about some pretty interesting subjects so far in the field of physical therapy. So today's episode really kind of rolls over from what we did last week. Last week we talked to Dr. Andrea Goce about obesity, and today we're going to be talking about wellness. And really those things are pretty well closely tied together. So today we're talking to Dr. Jose Gutierrez, Joey. So welcome to this, podcast episode, Joey. I'm glad to have you here with me.
Hello, everybody.
So Joey's been with Spine and Rehab Specialist for about 10 years now. Started with us as a technician, went to the Doctor of Physical Therapy program at UTEP, and then came back to work with us as Spine and Rehab Specialist as a physical therapist. He's the clinic manager here at our Edgemere location, and he has really had a number of advanced educational courses since he started with us. In the McKenzie method, would have been certified if they didn't cancel the certification exams last year. He's been functional capacity evaluation certified for several years now. He's dry needling certified. So he's really advanced his skills quite a bit here in the clinic. On top of that, he's always had a love for sports, plays sports himself. He helps me with UTEP athletics, and really I think that makes him a good candidate for today's episode on talking about wellness. So when we talk about wellness, what really is wellness, right? It's kind of maybe a vague term, or a term that can have different meanings for different people. So looked at a number of different definitions of wellness, and the one that kind of stood out was by the Global Wellness Institute. It says wellness is the active pursuit of activities, choices, and lifestyles that lead to a state of holistic health. Obviously, that's a big mouthful of words, but what stands out to me is the active pursuit part and the holistic health part. So, Joey, that means that a person really needs to make a conscious decision about wellness, correct?
Yes, they need to make that decision that they want to live healthy. They must want to be active and healthy. That is probably the first start. And if you look at the numbers you talked with Dr. Andrea Goce about last week, with 74% of people in the United States being overweight and 42% being obese, then yes, this is something that is very much needed.
Yeah, I agree definitely on that. So last week we learned about how obesity contributes to a number of diseases like diabetes, heart disease, stroke, certain types of cancer, but also to things like osteoarthritis and knee pain. So making that active decision to really be healthy, to work on wellness, is a must to help battle some of these conditions, right?
Yes, it is. But wellness really has a number of different dimensions that go beyond just that, Harry. There is the physical dimension, but also mental, emotional, social, spiritual, and environmental. Wellness just really goes beyond just losing weight and exercising.
Yeah, I think wellness is a very interesting concept, and I think everybody's probably going to agree that it's something that we want to strive for, right? Something that we want to accomplish. So I don't think there's going to be any disagreement on that wellness is a good thing.
Correct.
But I think it's easier said than done.
Yes, most people's lives are very busy with work, home life, friends, family, maybe other recreational activities or hobbies, volunteer work, etc. But I believe it is very important to not forget to think about yourself. And I don't mean this in a selfish way, but it is important to take care of yourself so you can be healthy for your family, for work, and just to feel overall better.
Yeah, so I think there's nothing wrong about thinking about yourself, saying, I'm going to work on myself so really I can be better at work, be better, dad, mom, whatever. So yeah, I think really that's, it's a good thing.
Definitely.
So of course at Spine and Rehab Specialist, we've realized for a long time that wellness is important. We rehab injuries. That's what physical therapy, does. And we've always looked at, we rehab injuries, we get people better to a certain point, and then what, right? There's something beyond that people need, that because nobody's going to be in physical therapy forever. I mean, physical therapy is typically something you do for, several weeks, maybe a couple of months or so, but that typically is it, and then it ends. So that's why we started a wellness program several years ago. So that way, after we recommend exercise in physical therapy, because it is such a big part of what we're doing in the clinic, at the time of discharge, when yes, we give people home exercises, but it's great to give them a sheet of paper with some exercises, go do these at home. But is that really going to happen or not? Some people, absolutely, they will be very motivated. They'll do it. But for some people, it's like, well, yeah, it's probably not going to happen. So great that we have this concept of you need to keep exercising, keep doing stuff. But then we take them out of this environment in the clinic where, they get motivated by the physical therapist, by the technicians, by the other patients to keep going. And now you're at home and you probably don't have that champion that really cheers you on. So, and, to be realistic, a gym is not for everybody, right? I mean, gyms are great, and definitely for some people, they serve a great purpose. But if you look at our typical patient, probably not really, right?
You're correct, Harry. And that is the main reason why we started our wellness program, is to create a place where people that are not gym buffs, gym material, whatever you want to call it, can come to exercise under supervision in a familiar and non-threatening environment. You go to a gym, it can be very intimidating with I don't want to say the majority, but maybe a lot of people there physically fit with fairly good muscle tone. That can be very intimidating, especially if you're coming out of an injury, have had chronic pain, you've really never exercised in your life, and the only exercises you know how to do are what your physical therapist showed you and told you to do. So yeah, that's why we created this wellness program.
Yeah, and I think that's what we're seeing in the clinic too, that the typical people in our wellness program are probably not people that go to the gym, right? That's definitely what we're seeing. So can you talk a little bit more just about our wellness program in general?
Yes, sir. So you sign up for to be in our wellness program, and you will be working with our technicians who will be your personal trainer. Now, I want to talk a little bit about that because our technicians, they all have an education in kinesiology, exercise science, and many of them have been involved in the Golden Age program at UTEP. So they definitely know what they are doing. I want to talk a little bit also about the Golden Age program. I myself graduated from UTEP in kinesiology in 2008, and we were also required to participate in this Golden Age program, which is designed for individuals, I believe, who are older than 60 years old. I can't remember the exact number. So we get to really work with that population and really determine a different type of exercise intensity that is beneficial for everyone of all ages. Because it is different to exercise, when you're 20 years old compared to when you're 30, 40, and even, of course, 60 and 70. So yes, our technicians do have good knowledge as far as how to adjust exercise intensity so you won't be in pain getting out of here. Maybe a little soreness, yeah, that's good, that's what we want, but we definitely don't want you to be in pain. So you will go through an initial assessment where to find out more about the client yourself and your health history, what your goals are, and what you want to achieve in the program. We do some measurements of strength, flexibility, body fat percentage, weight, so that we can set up a program directed towards the individual person like yourself.
Okay. So you definitely get the attention of our technicians, who definitely, I think they're very qualified between the Golden Age program and working with us. And we see populations of all ages. So, so definitely they're very well versed in working with different clients of different ages and different abilities.
Yes.
Now, is this like truly personal training?
It is up to a small group size of 3 people, so it may not always be true personal training, but you will always get the personal attention of your personal trainers. It's also good to remember that we do offer individual training sessions as well.
Okay. Yeah, because if I think about it, personal training can get actually very expensive. I did it a couple of years ago, and it starts adding up.
I did it as well, because not only do you have to pay for your personal trainer, but you're also having to pay a gym membership. So yes, personal training sessions are easily about $30 to $50 per hour, depending on where you go and how much experience a personal trainer has. And there isn't a guarantee that they are all knowledgeable, though. I know when I got certified to be a personal trainer, I got it in a weekend. The reason why I finished it so quickly is because I had my background in kinesiology, so I was able to go through the material, take the test, and pass it with flying colors. So, like I said, there isn't no guarantee that they are all knowledgeable. I know with us, your personal trainer is very knowledgeable because we work with them every day and we see what they do with their clients.
Yeah, so they have a lot more training. They may not have the personal trainer certificate necessarily, but they've had a lot more training. Yeah, I did one time I needed some continuing education hours, and I did a weekend course to be a certified fitness trainer, and it was, yeah, not very high content. And how much can you learn in a weekend, even if it is high content? So
Right.
I definitely agree that I think our technicians slash personal trainers have a lot more background and a lot more knowledge than probably your average personal trainer in a gym.
Definitely.
And by doing the program the way we're doing, I think we've been able to keep it affordable for most people.
Yes. For instance, if you come in twice a week, the price is $100 per month. So that works out to about $11 to $12 per session. And to me, that is very affordable for what you're getting. I mean, you're getting that knowledgeable one-on-one attention, and so to me, it's very affordable.
Yeah, I think it is too. I mean, yes, you can go to some of the big gyms in town and probably get a $20-30 a month membership, but that's just to use the equipment. That's all you get. Like I said earlier, you add in personal training, you're adding hundreds and hundreds of dollars per month easily.
Yes.
So good. Now we're also working on some very specific programs to really even match up clients better with their goals. Can you talk a little bit more about that, Joey?
Yes, sir. So we are developing a specific obesity/weight loss program. We know how hard it is to lose weight, but our program is very well designed to specifically address this. We have the knowledge and the equipment to get you to exercise, even if exercising is painful in a way. We have ways to make it easier. That way it is beneficial and you're getting what you need to get. We are reaching out to dietitians and nutritionists to get them involved as well, because as we know that a weight loss program, that's a huge component. I think in my opinion, 80% of weight loss is what you intake and 20% is what you do with physical activity. It's a very important part of overall wellness.
Yeah, so we're trying to really make that part of that program. So at least we definitely have the exercise portion down. And I do think that, again, that's the advantage because we have equipment. Like we have the Alter G that we can put somebody in. I think we talked about that a little bit last week or about the pool and really get people moving. Because it's great for a doctor to say, hey, you need to lose weight, go walk. But what if it just hurts too much to walk. So,
yeah, easier said than done.
Yeah, exactly. Mm-hmm. Right. So great. Any other programs that we're working on?
Well, I don't know if you touched on the Alter G last week, Harry, but I just wanted to touch, just refresh our audience on what the Alter G is. So the Alter G is an anti-gravity treadmill that has the technology to unload your body weight to up to 20%. So it makes it easier on your body to walk long distances, and even in an incline, we can even have you do some unloaded squats there if squatting is too painful, just to build up some muscle in a safe way. So
yeah, good, awesome, yes, definitely. So now we're also working on an athletic enhancement program, right?
Yes, we are implementing an athletic enhancement program, more geared towards athletes of all ages and abilities. So with this type of program, we're going to incorporate more sport-specific activities, and we can focus on one specific aspect like jumping ability, shoulder strengthening for pitchers, and stuff like that, just agility training, different exercises that the gym that you're going to may not have that type of equipment to address. And so...
Yeah, and again, we have that background knowledge, and good thing is we have a bunch of athletes here in the clinic, both the technicians and the therapists, so we can definitely help out a lot with that. And we want people to get better at whatever they're trying to accomplish, right? If that's a high school athlete who wants to be faster at the football field or jump higher at the basketball field, anything like that, we can definitely help them with that. And we're implementing this program, to help with that.
Yes.
We're also working on a program specifically designed for seniors,
Yes,
right?
sir. Yes. So this is a program that will have a little different exercise intensity, as I was talking about earlier in the podcast. And so this will focus more on things like balance. Uh, Harry, balance, fall risk, those are things that get more and more important as people age. And we want to make sure that we address that specifically because falling is not normal. And for a lot of individuals, they think that as we age, okay, I'm going to fall, that's normal. No, it's not.
No, it isn't normal, and it actually can be very very dangerous because as you get older, your bones tend to get a little weaker, a little bit more brittle too. And
Yes.
we definitely know falls are associated with broken hips and broken wrists and things like that, and that actually does not lead to good outcomes at all. So I think this program will really fill a void where people can then work on their strength and balance and stay active and stay safe in the community.
Yes.
Good. So it kind of sounds like we have something for everybody, right? All ages, all abilities, different purposes. And that's why that initial assessment, is so important to really come up with, what is it that the patient, well, actually client now, they may be former patients, but they're not patients anymore. And their clients, what do they want to work on? What do they need to work on? And come up with a plan.
Yes. Yes. I think we're doing an excellent job with that.
Good. So we're really working on getting these small groups together. It isn't completely one-on-one personal training. Is the small group. Can you tell me a little bit more about what it means to have this small group beyond just the fact that there's maybe 3 people there?
Yes, sir. So there is definitely a group dynamic involved, which includes the fact that clients can motivate each other. Maybe when you're just straight up not feeling it, you don't feel like coming in, I'm too sore. Then you can motivate each other. But you also see that people encourage progress they see. So it is perfectly okay if it develops into a social hour. I mean, it's that's what you're here for. We're going through a pandemic right now. We've been isolated in our home. I mean, not all of us, but a lot of us have. And this may be the only social time you get. So why not come in, have some social hour, get some good exercise, work on your balance, and just feel overall better. And I think that's what wellness is all about. So it's okay if you come in for social hour as long as you keep exercising.
Yeah, I agree with that. And of course, we started our wellness program way beyond the coronavirus pandemic. But I really think in this time, if you look at it, this is now going on a year. People have been isolated. They've been sitting at home. They haven't been exercising. Gyms are they have been closed for quite a while, and I think a lot of people just don't feel comfortable going to a gym because you don't know what's out there. So I really think there's a place for our wellness program. Because it is a safe environment, right?
Yes, sir. So, I mean, actually, I think it was today or yesterday that I read somewhere in the news that there seems to be increased cases in the coronavirus at gyms. I can't remember exactly what the headline was, but yeah, I mean that would freak me out as well. I would not want to go to the gym personally, so which is why I invested in a home gym, and that's why I'm doing what I'm doing. But as far as here, our cleanliness, we really raised up the bar. I mean, even before COVID-19, we were pretty clean, but now of course, we had to raise up the bar with our cleanliness. You will know and be sure that every piece of equipment was cleaned and will be cleaned after you use it. We're disinfecting the clinic on a daily basis, even multiple times a day, and that's just the kind of standard that we've developed with this pandemic. We all use masks. If you feel more comfortable with your trainer wearing a shield, we can provide them with a shield as well. Anything to make you feel safe. Whatever else we can do to make you feel safe and get you in here. That's really what it's all about.
Yeah, so you really get the cleanliness of the medical clinic, and still have that, wellness, fitness environment. And I think that's important to know too, because when you go to a gym, and to be honest with you, I have not gone back to my gym, just haven't really felt all that comfortable with it. But how clean are they, right? Because there you have people that some people believe in cleanliness and some people don't. Right. But you probably don't have somebody going after you, wiping everything down. So then you're relying on individual people if they wipe it down or not. Correct. And I think with us, you have that. No, we have people that wipe everything down pretty much after it's been used. So people should feel really, really safe about coming in. So good. Yes. Now, obviously, we're a physical therapy clinic. So is the physical therapist really still going to be involved with this wellness program?
No, Harry, not really. Not officially. It is considered. It is not considered physical therapy. But we do communicate with our personal trainers about what is going on if the client was one of our patients before the wellness program. And if there is a problem, the trainers will come to the physical therapist with a question, and we can always set up an appointment with a physical therapist if needed.
Yeah, and I like that because some of my patients, or former patients, are in this program, and it's, I always check on them. Hey, how are you doing? Oh, I'm doing great and feeling great. It's like, good. And if there's ever a time that, gosh, I'm really not doing very good, well, then maybe I need to take another look at it before this develops into a big problem. And yeah, we can always set up a free consult, or if needed, a full physical therapy evaluation to figure if something's going on. And that's, again, the nice thing with having our technicians working with them. They're really good about picking up on signals that, hey, something isn't right. It's not just soreness, because we know people that are exercising are going to be sore, and that's perfectly fine. But we definitely have that confidence that if something else is going on, they'll come up to us and say, hey, can we take a look at this? Which is awesome.
Yes, which makes it different than going to a personal trainer who really doesn't have that knowledge or experience with working with individuals who have been injured or who have had chronic pain. Yeah, you're right. Our technicians are knowledgeable to detect anything that this ain't right. Let me get some help. Let me get a physical therapist to help me out, and let's go from there.
Yeah, it's awesome. So, kind of going back to that initial definition of wellness, we definitely encourage everyone to actively pursue, make that decision, to pursue a healthy lifestyle that really leads to holistic health, that makes you feel better, makes your health better, helps prevent, some of these diseases, that you could get. And to be honest with you, even, exercising will increase your immune system. So there's even, an advantage to, possibly help, prevent this coronavirus thing, by improving your immune system. So that's awesome. Mm-hmm. So we definitely encourage everybody to be part of our wellness program. Give us a call, sign up. And Joey, can they just come in if they're not really sure? Can somebody just?
Yes, absolutely. If you're not sure, come take a tour of our facilities, meet one of our trainers, meet with our physical therapists, meet with our staff, ask any questions that you may have, any doubts, any concerns. We'll be more than happy to explain all this to you and address any concerns that you may have. That way you just feel as comfortable as you can to come get healthy, start exercising, whatever it takes. We can provide that.
Yes, because this program, obviously, if you've been our patient before, you're already comfortable with the environment. You already know what to expect. But this isn't only for previous patients of us. This is really open to the public. Anybody can sign up for that, right?
Correct.
Good. Yes. Awesome. Well, I think we've come to the end of this episode of the Spine and Rehab Specialist podcast, episode number 4. Joey, thank you so much for being part of this episode. I hope everyone learned more about wellness, and I'm really hoping that it kind of motivates people to actively pursue a healthy lifestyle.
Thank you for having me.
All right. Thanks, Joey. All right.